mini facelift, SMAS lip, deep plane facelift, neck lip, thread lip, liquid facelift. I know, the names get overwhelming very fast. And when every one of them is marketed as the best, that doesn't make it any easier. Here's the truth, most of these videos won't tell you. These are not different names for the same operation. They work on different layers of the face, they solve different problems, and some of them, in my honest opinion, barely deserve place in the conversation at all. I'm Dr. Yasumasa, board certified plastic surgeon specializing in rhinoplasty and facial surgery. In this video, I'm going to walk you through every major facial rejuvenation option as a surgeon who actually performs them, and we will tell you in plain words which ones of these works and which one doesn't work. By the end, you'll understand what each option does, what it does not do, and how to think about what might actually make sense for your face. Let me start with the single most important thing to understand, because once this clicks, everything else falls into place. The face doesn't age as one thing, it ages in layers. And to understand these layers, there's the skin itself, its texture, its fine lines, the sun damage, the way it thins over time. Underneath that skin is volume, the fat layer. And this is a layer that deflates and slides downward over the years that go on. And believe it or not, there are 21 specific superficial fat compartments in our face that have very careful areas throughout our face that deflate and age differently. Beneath that is a supportive layer. This is the deeper structural layer that encases our facial muscles. This is called the SMAS, the superficial myoaponeurotic system. And believe me, it's hard to say all at once. And that's the layer that your jowls, your mid-face, your neck muscle, and then your temporalis fascia, it's all in one unit. And they're all synthesized into one layer essentially. Holding everything in place are retaining ligaments. And these are ligaments that go down from the bone in your face and they span through the SMAS, through the fatty layer into your skin. And this is the layer that once the ligaments loosen, it allows that superficial layer, the fat, some of the SMAS to actually sag and move downward. And then finally, there's the neck. And this is its own problem because it has its own specific unique layers of deep and superficial structures that need to be addressed in facial rejuvenation. And then finally, there's the bone, the chin, the jawline, the cheekbones, and everything that's draped over that is what we just mentioned, the SMAS, the fat, the skin, all spanned with the ligaments. So here's why all this really matters. No single procedure fixes every layer. A facelift really can't treat sun-damaged skin. Skin resurfacing can really treat jowls that have dropped. And filler really can't reposition tissues back up onto your face. So when someone comes to me convinced that they need a liquid facelift, the real story might be actually a weak chin needing augmentation or a true deep plane facelift to reposition that superficial tissue. And sometimes it really isn't boost skin at all, they need volume. So the real art is in matching the right operation to the problem that they see in the mirror, matching the right tool to the anatomy. So let's get into it and go through all of them together. Let's start off with the surface, the skin layer. This is something patients often are surprised to hear, but a facelift repositions the envelope. It doesn't really do anything to change the quality of your skin itself. But think about it. Textures, fine wrinkles on your face, sun damage, pigment changes that you see, they all live on that superficial surface, the skin. And to treat that, you need surface treatments. Things like a laser resurfacing, chemical peels, microneedling, or even skincare. That's why a beautifully lifted face can still look aged if the skin surface is never really addressed. It's also why I oftentimes will pair laser resurfacing with a good facelift. These aren't really competing options. They're actually working together to give the most powerful rejuvenation and a natural result for the patient. Now, the next layer is volume, the fatty layer. A lip moves tissues back into position, but what it doesn't do is restore the volume that you've lost. Now, like I mentioned before, there are about 21 fat compartments in our face. These are superficial. They're between the skin and that layer called the SMAS. And believe it or not, they age at a different rate. Classically, the ones that don't tend to really deflate early on are the ones that we don't like the most, which is the navel labial folds and the jowls. But we do see other structural fat compartments age quicker, and that would really unmasks the aging of our face. So that's where fat transfer really comes into place. At the time of surgery, we can take your own fat, we can process that fat to remove the liquid and the oily layers, and we can re-inject that into these fat compartments to restore volume and to address areas that have hollowed that most patients really are bothered by, the areas in our mid-face, the areas around our mouth. And when you lose volume, that's when you accentuate the hollowness and the wrinkles that you might see when you animate and smile or cry as well sometimes. Now, think about it like this. Filler and fat, while they do address volume, they address it differently. Filler classically is injected in a non-anatomic place, sometimes above the bone, sometimes into the fat compartments. Fat itself is classically injected into the fat compartment, so it's a very pure, natural anatomic way of restoring volume. And when done correctly with a facelift, can truly give you that natural, restored look. When you forget to do a fat transfer and you only do a facelift, you sometimes will run the risk of looking a little unnatural or over pulled because you haven't addressed that one component of aging, which is volume loss. And now we get to the heart of the conversation, the layer that most of these famous facelifts are named after, the SMAS, the superficial myoaponeurotic system. The SMAS is a deep structural supportive layer that I mentioned before. It's the sheet your jowls, your sagging midface are all attached to. Now, back in the early days of facelifting, I'd say probably in the 60s and 70s, going into some of the 80s, facelift surgeons were only tightening the skin. They call it a skin-only facelift. And those results, as we learned over the years, really didn't last because you ignored this structural layer. This is a layer that's doing all the heavy weightlifting, and when you ignore it, you don't get a great result. So here's a framing I really want you to hold on to. Most of the named types of facelift are simply different ways of handling the SMAS. It sit on a spectrum from the most gentle to the most structural and invasive. And they're not completely separate operations. At the gentler end, you have the techniques that work on the SMAS itself. So one example is the SMAS plication, where that SMAS layer is folded over and stitched together to tighten it. Nothing is really cut. It's a solid option for milder, lower face aging. A step up from that would be SMASectomy, where a strip of the SMAS is excised and cut out, and those two edges are then sewed together and tightened. This gives you a little bit more of a deeper structural effect when you're doing the facelift. And then you have the approaches that work beneath the SMAS, the deep plane. The deep plane lip dissects underneath that supportive layer and releases the ligaments that have been holding the dropped tissue down. And these are the ligaments that, again, span from the bone all the way up to the skin. And by releasing those ligaments, you're able to then mobilize the deep plane and the tissues above it. So that would be jowl, the cheek fat pads, in many cases the neck. And so when you release that, you're able to mobilize it and reposition it as one unit back up onto your face in a normal anatomic position. And that look tends to be very natural and long-lasting as well. Now, within this deep plane category, there are different variations of dissection. And it really has to do with kind of where you're dissecting and then where you're mobilizing. So for example, there's a high SMAS approach where the dissection is higher to capture more of the midface and cheek. And so within the deep plane category, there are variations. For example, there is the high SMAS approach, which carries a dissection higher to capture more of the midface and cheek. Now, another option would be an extended deep plane, which is a broader release across the midface and the lower face and the neck together. So you can get a more advanced restoration of your anatomy and restore that across multiple zones all at once. To be honest with you, the deep plane is what I most often reach for in the right patient. But deep plane is not a magic word. It's the right answer for some faces, but not for every face. If you had a prior facelift, for example, re-elevating that deep plane may not be the most technically simple approach. And doing a SMAS plication or a SMASectomy is not only safer, but equally effective. For the right anatomy, a well-executed SMAS technique can absolutely be the better choice, but the technique should fit you, shouldn't be the other way around, where the surgeon is trying to fit you to the technique. Now, a whole other category is the whole short or mini category. And anytime you put the word short in front of a surgery name or the word mini in front of a surgery name, patients tend to think like, this is the right option for me. It's going to be reduced downtime with the same result. And I'm here to demystify that false notion realistically. Think of it like this. Anytime you have the word short or mini, you should also put that word in front of your result. You're gonna have a short result or a mini result. And that's truly the way to think about it. So some of these techniques like a lifestyle facelift or a mini facelift were really marketed several decades ago, like in the 90s, for example. And patients went into thinking that this is the right option for them. What we've learned over the years is that these mini techniques give you mini results. And when you're thinking about redraping the face and the whole envelope, I mentioned before, everything is one unit. when you only pull it from small directions, you're actually going to get more of an unnatural result. So, in my opinion, mini facelifts really don't have a major role in the modern facial rejuvenation. Patients are very savvy today. They want the restoration, but they want to look natural. They want to look like nothing was done. And realistically, these many approaches really don't have a major role in this whole category. Now, there are other options that you can do that do have the role. Short scar facelifts or neck lifts. So what does that really mean? The whole face and neck lift scar has a classic pattern. It's right in front of the tuft of the hair. It follows the shadows and peaks of your anterior ear, goes behind the tragus around your earlobe, then it goes behind your ear right in that crease and then follows the hairline. That's pretty much the entire scar. When you say short scar, you're removing a part of that whole incision in order to do the full procedure. So when you say a short scar facelift, or more importantly, a short scar neck lift, on average, you're doing half of that incision and trying to get access to the deeper structures to do the deeper layer work. And in many cases, that works well for patients who are very early in aging, or quite frankly, don't need the other aspects of a procedure. So classically, in my practice, I'll be doing a short scar neck lift to really address the neck. Neck is always the number one thing that patients are looking to restore. And it's kind of the first thing in the aging spectrum that people try to restore. So short scar neck lift makes sense for me in my practice, where half of that incision is done. It's right around the earlobe, goes behind the ear, back into the hairline. And I have access to the deep neck layers so I can do all the structural work that I need to. Now, the skin that I remove is only going to follow that incision pattern. So you're not going to get a lot of change in your mid face and lower face, quite frankly, because the incision isn't there. And so that to me is something that makes sense. The short scar versions of some of these facelifts will work for some patients, but you have to realize you're going to get a slightly lesser result. It's not the same as a facelift or a full neck lift. And it really shouldn't be sold that way to you at the end of the day. Let's talk about the neck, because this is where one of the biggest myths live. A lot of people assume a facelift automatically fixes the neck. It does not. The neck is its own problem with its own layers, and it deserves its own plan. So what actually drives a heavy or undefined neck? It can be loose neck skin. It can be the fat sitting above the muscle, but more importantly, it can also be the fat sitting beneath the muscle, the fat that we call subplatysmal fat. It can be the platysmal bands, which is your platysmal muscles that have kind of become accentuated, central bands rather than lateral bands. It can come from deeper structures that blunt the angle of the neck, and these are the digastric muscles and the submandibular glands. And these are deeper structures that we're talking about. So here's the takeaway. Those sharp, defined necks that people admire, they usually come from addressing some of these deeper structures, the digastric muscles, the glands as well, trimming them, contouring them so you get more shadowing in that area. That deeper work is really where the lasting neck definition is won or lost. So when I plan a neck lift, I treat it as its own considered procedure, not as an afterthought tacked onto a facelift. And quite frankly, you have to customize the approach. Does everybody need glands excised or trimmed or the digastric muscles reduced? Absolutely not. Does everybody need platysmal work? In most cases, yes. Now, the thing to think about is the more extensive you get, the deeper you go, the more the risk, slightly longer recovery, and slightly more complication profile. So understanding these things, having a conversation with your surgeon, and tailoring the plan for what you're looking for is really the most important thing during a facelift consultation. Then there's the foundation that almost everyone forgets. It's the bone, the chin, and the jawline. And a surprising amount of what looks like a weak jawline or a bad neck is actually a smaller recessed chin. It has nothing to do with the soft tissues that are layered above the bony structures. A chin is a bony platform that the entire lower face and neck are draped over. If that platform is weak, it flattens the angle between the chin and the neck, no matter how good the soft tissue work is. So when I'm analyzing the face and talking about a neck rejuvenation with the facelift, I'm always looking at the bony structure. In some cases, you need to do a chin augmentation to bring out that chin point so you can really appreciate a nice submental angle going on to the neck. When that distance is short, you sometimes lose the powerful effect that you can get with a really good neck lift. Two more pieces that really complete the picture. They are the brows and the eyes. So a brow lift isn't technically a facelift, but it matters because a low, heavy brow can make your eyes read as tired, sad, or even angry sometimes. And lifting the lower face or even the mid face does nothing to change that. Now, eyelid surgery, or in other words, blepharoplasty, upper and lower blepharoplasty, addresses heavy upper lids and bags below the eyes. Even an excellent facelift can look incomplete if the eyes still look exhausted. And oftentimes, this is when you look artificially lifted because you've forgotten the area that most people are noticing, which is your eyes. So it's really the difference between looking overdone or more natural and relaxed, believe it or not. These are the details that take a result from lifted to genuinely balanced and refreshed. When you're doing a deep plane face and neck lift and you're recruiting tissue that moves all the way up, when you forget about the upper face, which is sometimes your eyes and your brow, you see that distinct junction between those two areas. So in my opinion, it's really important to treat the face universally and include components of brow lifting with the eyes when you're doing a face and neck lift. Now, like I mentioned before, everybody ages differently and parts of the face may age more than others. Not everyone needs an extensive brow lift or an eyelid lift. In many cases, when I'm analyzing the face, when patients need a powerful face and neck lift, they more than likely will need something done to their upper face so they don't see that distinction between something that was touched and something that wasn't touched, for example. And it's the difference between looking overdone and actually looking natural, believe it or not. You want to look natural and rested. And so when you treat the face universally, you actually achieve that. A lot of patients get concerned that, oh my gosh, I'm doing my brow, my eyes, and my face. It's too much. I want to look natural. But like I mentioned before, when you don't treat the face as one unit, you actually run the risk of looking more unnatural that way. Okay, so we talked all about surgery. Now let's talk about the non-surgical options because there's a lot of marketing here and I want to cut right through it. First, the so-called liquid facelift. This is filler and sometimes neuromodulators used to create a refreshed look. It can be great for the right person, but just to be clear, it's not a lift. It adds volume and softens areas of hollowing, but it doesn't reposition deep tissue back into its normal anatomic place, and it does not remove loose skin. The trouble is where it's sold as a substitute for surgery because it truly isn't. In my opinion, it's more of a gap procedure. It's between the person that definitely doesn't need a facelift and needs a facelift and is somewhere in the middle. And when done tastefully and sparingly, it has a great role. But when it's overdone, that's where the problem arises. And that's where the surgery can actually get very challenging as well. Another non-surgical option are thread lifts. And I'll be very direct with you, I really don't recommend performing thread lifts. A thread lift can create a subtle, temporary lift for a very mild laxity, but the effect is modest and very short-lived. They don't address true jowling, they don't address neck laxity, or deeper tissue descent. And when you weigh the cost against how long it actually lasts, I'd much rather do the right operation once than chase the temporary result again and again. And then finally, there are the energy-based skin tightening options. Radiofrequency, which is one energy type, ultrasound, laser-based devices. And all these are energy types. And when you add energy, which is heat, to your tissues, they create some degree of tightening. And the goal with all these options are to give a very controlled, modulated approach of adding heat and energy to your skin to get a very careful, safe degree of skin tightening. Now, similarly, I'll be honest, I have offered all of these in the past and I still do a combination of these from time to time. For example, laser resurfacing is great as a standalone for improving skin quality or doing with the facelift, but it's not a replacement for a facelift. And much similarly, ultrasound and radiofrequency type energy devices to tighten the skin are not surgical replacements. And I have a very honest conversation with my patients about what they're trying to achieve and what they can expect after having a procedure like this. And in many cases, patients choose to have it because they don't want to do surgery, but they still want to do something safely and not burn the bridge in the future. And I think these options are great for that person. But for someone that is ready for a facelift and wants a facelift result, these options are not the right option. And in fact, I think they're just misplaced for them. And so You deserve to hear that before you invest in a series of treatments like this. And I think that's really important to understand. Let's talk about timing. Now, this is a question that I know all of you are really thinking about and want me to answer. How long do these options truly last? So let's talk about the surgery. A well-executed surgical lift, a good SMAS or deep plane facelift procedure can really meaningfully reset the clock. And I'm talking about looking a solid 15, sometimes even 20 years younger. And that's something you can really expect in the right patient, but that's not the same for everybody. The goal is to look like a better version of yourself, not like a different person, and look more youthful, more restored, and rejuvenated. Now, how long is this really going to last? It's different for everyone. I tell patients, when I'm done with your facelift, the moment you leave that operating room, you're going to start aging again because aging is nonstop. Gravity is constant, sun exposure is constant, and stress, unfortunately, in our world is very constant. And all these things factor into how we age. What I tell patients is you're going to age a little differently because what we've done is we have restored the deeper layers to your face and restructured your face so it's pulled up over time. Skin aging will continue, and other aspects of weight gain and weight loss may continue as well. I tell patients, I think you age differently. If you didn't do a facelift and you waited 10 years, you would continue down that spectrum. If you did a facelift procedure at a certain point in time, you're actually not going to look the same as if you didn't do a facelift in 10 years, but you will continue to age, and that's different for everybody. On average, patients like to think that a facelift will last anywhere between 5 to 15 years, and that difference really has to do with your genetics and how you maintain your result, and at the end of the day, how you age. The non-surgical options, fillers, radiofrequency skin tightening, energy-based skin tightening devices, thread lifts, they're definitely shorter-lived results. And I would say months to maybe a year at most, maybe 2 years at most. And that's something that is consistently something you can expect with a procedure like that. The temporary options aren't a bad thing, but it's important to understand how long they're going to last you and for you to weigh the cost benefit ratio there realistically. At the end of the day, the right choice really depends on your timeline and your specific goals. And that conversation you have to have with your surgeon who's doing your procedure, whether it be something short-lived like the non-surgical option or a true surgery itself. So here's a simplistic decision map that you can use. Now, this is not a one size fits all, and this is not something that I would say works for everybody, but it's the way to think about your face and what options might work well for you. So if you have mild aging, good skin quality, you might actually do well with a non-surgical option, whether it be a little bit of filler, a little bit of resurfacing, or radiofrequency or ultrasound skin tightening. Or you might be a good candidate for a short scar neck lift to address any lower face and neck aging that you're seeing. Moving up from there, if you have moderate jowling and you're moving on up to your face area now, this is where you need to look into more facelift procedures, a SMAS-based lift. So a SMAS bication, SMASectomy, or the classic deep plane facelift. You can combine these with laser resurfacing. You can combine this with facial fat grafting, which is very powerful. If you truly have a deeper descent and heavier folds throughout your face, neck laxity, obtuse cervical mental angle, loss of your jawline, you're definitely a candidate for a deep plane face and neck lift. And talking about the other options I mentioned before really won't do you justice and won't really give you much of a result. And again, when you pair the right operation with the right anatomy and the right goal, you get a great result. Remember, this is a map, this is not a prescription. Your anatomy is what really dictates what you should get. And that really leads me to talking about age. A lot of times patients will ask me, well, is there a certain age where I should start looking into a facelift? It's really not about your age. It's really about what you see in the mirror and it's about your anatomy. So having said that, somebody in their late 30s and 40s can actually get a face and neck lift. And somebody in their 50s and 60s can still get a face and neck lift. Same operation with two people in very different decades of their life, but they've had different experiences in life and they've aged differently. So it has to do with your anatomy and not so much of your age. The right plan isn't the trendiest procedure or the one with the best marketing. It's the one that matches your anatomy and your goals, your recovery timeline, and the results you're actually looking to get. If you're considering facial rejuvenation and you want to understand what's right for your face, the next step is to schedule a consultation through the link in the description. That's where we can look at your face properly, talk you through your concerns, and build and design a specific plan around you.